Thank you for the opportunity to discuss the results of our project, a mixed methods process evaluation of an advanced care planning interventions in nursing homes. Advanced care planning is a process which enables people to define their goals and preferences for future medical treatment and care, to discuss those with family and healthcare providers, and to record and review them when appropriate. To implement advanced care planning in the nursing home context in Flanders, in Belgium, we developed a multi-component whole setting intervention using an in-depth development approach based on the UK MRC framework and the theory of change methodology developed by the Aspen Institute. Our intervention components were multiple. Central were the use of an external trainer who helped with a stepwise implementation over 8 months. They trained ACP reference persons, people in the facility championing the intervention. And they also trained, together with ACP reference persons, conversation leaders, people leading ACP conversations, and all of the staff and volunteer who functioned as antennas to pick up triggers to start difficult conversations. We used conversation guides to lead ACP conversations. In a mixed method process evaluation, we followed 7 intervention homes alongside a cluster RCT in 14 nursing homes. We evaluated implementation, mechanisms of impact, and contextual factors. We did that by measuring during implementation and post-intervention. We used diaries, surveys, interviews for this. The outcomes of the effectiveness evaluation of the ACP Plus intervention showed small but significant increase in advanced care planning self-efficacy among staff. So staff felt more confident in doing these conversations. There was no effect on knowledge about the law and legal requirements when it concerned advanced care planning. Qualitatively, we found an increase in awareness of colleagues concerning the importance of advanced care planning. And many staff also indicated that they found the way they did advanced care planning was more structured. They also perceived more conversation and documentation in the intervention homes. In terms of implementation, overall, an implementation score of 7.3 out of 10 across the 7 facilities was obtained, but there was definitely an implementation problem with reaching all staff. All reference persons were reached with training, but not the advanced care planning conversation facilitators and the antennas. This was only 1 in 3. Important mechanisms of impact were having someone, a coordinator in place to coordinate the whole study, and, for example, also the need for in-depth on-the-job training of all those involved. Contextual factors that were of influence in the implementation were having time and resources, and staffing levels and workforce issues such as staff turnover, which are not unique to these interventions, but which are that are found often in interventions in this context. We recommended for the future that our ACP Plus intervention really needs further adaptation. We need more than 8 months for implementation, and we need to increase the reach of the intervention. We need to focus more on changing the behavior of all staff via on-the-job training. As these contextual factors that I highlighted are not unique to this study, I think having adequate resources and personnel for this sector is a precondition to be able to improve care. So thank you very much, and to all the collaborators in this study and all participants, of course.